Hello, everyone, and welcome to Grey Matter, your one stop shop to all your exam preparation needs. As you know, we are talking about the UKMLA series, in which we are talking about the different domains of the UKMLA. Today, we are going to continue on the previous video, and we are going to talk about the general practice and the primary health care, and the presentations and the conditions that encompass within this practice. So, the first presentation today we are going to talk about is lymphadenopathy. Now, the lymphadenopathy can be due to upper limb or lower limb. So, most likely, this occurs as a result of infection. Any infection, it can be tuberculosis, and it can be some form of cancer, but in cancer they will be the flaws will be positive. It is fever, loss of appetite, or weight loss. Now, menopausal problems, this is another inclusion in the gynae section, and it can be due to various different gynecological reasons, which we are going to talk about in the later videos. The menstrual problems, the same things. Muscle pain, myalgia, we have talked about it. Painful ear, it can be due to any number of infections of the ear, and it can be due to otitis media, it can be due to otitis externa, which depends upon the tragus test. If the tragus test is positive, it can be due to otitis externa. Painful sexual intercourse. Now, this is also associated with the gynecological section. Painful swollen leg, it can be due to a number of causes. It can be DVT, and so you need to check the peripheral pulses in this case, and you need to do a Doppler's ultrasound. Pelvic pain, it can be due to a number of problems depending upon whether it's a male or a female. Most likely this comes in the cases of females, and it can be a urinary problem or it can be a gynecological problem. Perianal symptoms, this includes any discharge of blood through the feces, or any painful discharge, or hemorrhoids. Peripheral edema and ankle swelling, mostly associated with kidney problems or cardiac problems. Sleep problems, which is most likely due to depression, and it can be due to NAI, non-accidental injuries, which is a very important section of the UKMLA. Soft tissue injury, it can result due to any sport injuries or any fall. Somatization, and which is medically unexplained physical symptoms. It is usually associated due to some psychological issue of the patient. Sore throat, we already know what that is. Struggling to cope at home, this is a psychological problem. This is basically a counseling session where you have to offer the counseling services to the patient. So fertility, again a gynecological issue. And substance misuse, in such cases it can be an alcohol misuse, it can be heroin misuse, and any number of drugs misuse. Most likely these are the two drugs that are mostly encountered in the UKMLA, and there are certain counter drugs that we give, and certain protocols that we follow, and certain questions that we ask in order to get to the bottom of this. Then there are swallowing problems, we have already discussed it. The sick child, tinnitus, which is a ringing sensation in the ear, and it can be due to any number of problems concerning the ear. Trauma, it can be trauma due to any area of the body. Travel health advice, a patient will come to you and will be like they want to travel to certain area, certain country, and you need to give them advice regarding the necessary vaccinations of that area. Tremors, it can be intentional tremors, it can be unintentional tremors, and can result in number of problems. Most likely it comes in the form of Parkinson's disease or essential tremor. Unwanted pregnancy and termination, this usually comes in the form of an underage, not underage, like under 18, a girl is pregnant and she wants to carry a miscarriage, she wants to carry an abortion, and you have to counsel the patient regarding different methods. Urinary symptoms, we have discussed it. Vaccinations, this is very important in the pediatric section, we have discussed it. Vaginal discharge, we have talked about it. Vertigo, this usually comes in the ENT section and can be due to Meniere's disease or vestibular neuritis, and that depends upon the presence of deafness and tinnitus. Weight gain, it can be intentional weight gain, it can be unintentional weight gain. Mostly it depends upon the dietary and sedentary lifestyle. The well-being checks, that is usually the routine checks that you do of the patients in order to find out that anything is going wrong health-wise. Wheeze, we already know it is associated with asthma. Now the conditions, most of them we have already talked about. Hypothyroidism we have talked about. Impetigo we have talked about. Infection mononucleosis we have talked about. Influenza we have talked about. IBS we have talked about. Lower limb soft tissue injury we have talked about. Lyme's disease, this is usually due to a tick bite. A patient usually presents with these targeted lesions, and they usually go around and walk their dogs. So usually make sure to ask the history of the patient, whether they have any pets, and whether they walk their dogs. Measles, against coptic-like spots all over the body and especially on the tongue. The menopause we have talked about. Migraine we have talked about. The headaches on the one side along with aura. Mumps, this is a swelling of the parotid gland. It can be a one side of the face, and this swelling can be associated with orchitis. And obesity, we have talked about it. Osteoarthritis, we have talked about it. Osteoporosis, we have talked about it. Otitis externa, otitis media, we have talked about it. Parkinson's disease, which we have talked about it. Parkinson's disease will be associated with intentional tremors and cerebellar problems, and difficulty with mobility and rigidity. Mostly this occurs in the form of a follow-up, where the patient is taking levodopa and they want to leave. The symptoms have improved and they want to leave the drug. You have to do an examination of the patient, a quick examination, and then you have to advise the patient that they have to continue taking the drug. Pelvic inflammatory disease, a patient comes with lower abdominal pain, and it usually is associated symptomatically quite common to the appendicitis. But in this cases, remember, when a female comes and her symptoms are very close to the appendicitis, always ask for vaginal discharge. If there is vaginal discharge present, then this is PID. So the symptoms of the appendicitis plus vaginal discharge is PID. Peripheral vascular disease, it will be a pain in the lower limbs or upper limbs, which can be relieved by rest or does not relieve by rest. You have to denote it on the Doppler's ultrasound. Polymyalgia rheumatica, this is involved in the rheumatological diseases. A back pain associated most likely in the form of a like you can call it like the winging of scapula, so it involves the back like that. The prostate cancer, the PSA will be raised enormously. The flaws would be present, and there will be problems with the urination. Psoriasis, it is associated with the dermatological issues. Radiculopathies, reactive arthritis. This is reactive arthritis associated with the hearing and the vision as well. The rhinosinusitis, we have talked about it. Substance use disorder, we have talked about it. Syphilis, can be neurodegenerative syphilis, and mostly it is an STI. It can represent as a canker or a lesion on the genitalia. Tension headaches, very important and very common station. Take the whole history of the headache, and the only positive finding will be stress in the life. Tonsillitis, a child will be having tonsils, infection of the throat, and his tonsils would be enlarged. The mother would be worried and would want the tonsils to be removed, but they have to meet a certain criteria in order to get tonsillectomy done. You have to consult the patient regarding it. Trichomonas vaginalis, we have talked about it. Trigeminal neuralgia, this is the pain on the face. The trigeminal nerve is inflamed, and it is due to the antibodies of the body being affected. And upper limb soft tissue injury, we have talked about it. Urinary incontinence, UTI, we have talked about it. Urticaria infection with the allergic reaction. Varicella zoster virus, varicose veins, we have talked about it. With the vagal syncope, we have talked about it. A patient he presents with fall immediately after, like he's standing and he hears some stressful news, and they have a attack of syncope. Venous ulcers, they're usually associated with the peripheral vascular diseases, the viral exanthema, viral gastroenteritis. These are all simple infections that have a viral countermark. The whooping cough, and that is associated in the pediatric section. So, guys, there you go. We have completed today the general practice and primary healthcare section of the UKMLA. All of these topics, almost all of them have been associated and have been present in the PLAB2 exam. Nothing new that you have been found, so you don't need to worry about much of the changes that have been implemented in the UKMLA. Not much have been changed, few topics here and there, that's it. The whole idea is simple, the whole structure remains the same. So just don't worry about it. If you have been practicing for PLAB 2, it's almost the same as that. So there you go, guys. Please like, share, and subscribe the video.